Okay, so welcome everyone today to Innovation Without Barriers, Scaling Accessible Healthcare Education with Dr. Interested. So we welcome you guys to our workshop where we will be sharing how Dr. Interested came to be and then sharing Emma's innovation as well as how you can also make your project of your own.
So we just want to thank Canadian Innovation Space along with the Rideau Hall Foundation for their support of this event. We are so happy that Dr. Interested can participate in the Canadian Innovation Week. Our summary of what Dr. Interested is, along with our work, will be on our website, and we'll go straight to the innovations showcase from here.
So Ahana, hope I pronounced their name right. She picks symptom C, which is teenagers spending hours on social media but still feels alone. So the first why behind this could be what she says, which is digital communication not always having the same depth as in-person conversations, and how teens often get FOMO, which is the fear of missing out from social media, as well as how they're often dopamine chasing and they get trapped in a loop where likes and comments make them happier short term, but they're rarely enjoying something outdoors with people in person. So and then she also expanded into the fifth why, which is how they use this to manage their social anxiety, but this is actually making it worse. So now we can have a product or a program that targets us, helping them manage their social anxiety and slowly learn how to build in-person connections with others. So now we still have a lot of great responses. Feel free to look at it in the chat as well. We will be moving on to our next section, which is so now I'll once again welcome Emma. So she's right there. She's a runner-up at this Disease Discovery Day event that Dr. Interested hosted a few months ago, and we will let her take over and share her experience here.
Thank you, Chris. Okay, so hi everyone. My name is Emma, and I'm the second place winner for Dr. Interested's Disease Discovery Days event. So before I get into some of my experiences with this organization, I wanted to thank Adele, Chris, and Lalit for giving me this opportunity to speak today. So, to begin, as someone who wasn't particularly interested in or good at science, I never imagined that partaking in disease discovery days could put me into an entirely new perspective. What I thought would be just another extracurricular activity ended up completely shifting my academic interests. During the program, I took on the role of a researcher and looked into type 2 diabetes, which my mom suffers from. I looked into the changes in her diet and energy levels and compared her symptoms with and national populations affected by the condition. So on this slide, you can see I've included some graphs and some other visuals to help readers understand. And so while researching, the executive members of Dr. Interested also provided me with helpful tips, how to find resources, and also gave me lots of guidelines for how to create a clear presentation. So because of their good advice, I discovered a newfound passion for learning about diseases and especially public health. On the day of the presentation, it was so amazing to receive encouragement from my peers and also hear about how healthcare systems are being developed globally, as there are many international members of this organization. So ultimately, it has been an amazing past few months being a part of Dr. Interested, and I'm super thrilled for what the organization has in store for the future. Thank you so much for listening.
Thank you, Emma, for sharing that inspiring journey. Now that we've seen what's possible, let's talk about how we can actually solve the problem we identify. There are two common ways of solving the problem. First is through a product. This is a tangible innovation like an app or even like hardware. It's driven by participation and specifically solves a social or accessibility gap. Think of things like peer tutoring network or support systems. Next is scaling your impact. We've now identified a problem, but the big question is how can we execute this effectively? The first and most critical step is to start with an MVP, or it's short for minimum viable product. For example, if you had $0 and 7 days, what is the simplest product you can create to prove people want your solution? Starting with something like this prevents from creating like a product that no one needs. We chose something that you start with, which is small. You don't need a massive budget to begin. For example, you could start by simply posting a Google Form survey in a community group or gather data and interest. Next, once you have an MVP, the next steps are to prove your product market fit and to focus on sustainability. To prove your product market fit, you pilot the product and do primary research and collect user feedback from your target population. To focus on how you make your solution sustainable, you can ask yourself, how can you run the nonprofit and continue producing the product in a standardized way? Also, how can you make it more efficient? So now I'm going to give you guys about 15 to 20 minutes. You can plan your idea out. And yeah, remember the goal is to scale your impact in ways that can be easily replicated by your team. Once the time's up, you guys can volunteer to present.
A reminder that if you guys do want to present, that will give you an extra entry into the raffle, so that's a lot of incentive to do it. And if you have any questions, raise your hand or feel free to put them in the chat while you work on your impact project.
So if you don't know what problem you want to solve, you can refer to the symptoms and the 5 whys that you did just now. So you can use that problem and then come up with like an MVP just briefly, and you can share it in the chat or put your hands up and you can share it with everyone else. And then we'll give you some time to brainstorm. So I know many of you guys are still brainstorming. So to give you a better idea of what an MVP could be, so you guys can keep working while I talk. The MVP, as we mentioned previously, it's the minimum viable product, which is the smallest thing you can do to solve the problem that you have. So remember how we had the problem where medical devices are too expensive for seniors? So an MVP here could be just simply calling a local senior care center to see if they have any equipments that they don't have or things that they can donate because they have extras. And then we can also maybe post a community post online to find families that can donate some of their used equipments. We can get it back, repair it if you want, and then you can donate it to the senior care centers that needs help. So it doesn't really have to be something fancy. You don't have to start right away and be like a giant nonprofit that has this huge connections of people and have partnerships with other medical device companies for free device donations to like the seniors. So it doesn't really have to be something that complicated, and it could be just simple as calling, connecting one-on-one, connecting a family to someone who is in need, and then helping them facilitate the donation. Okay, so I'll start sharing Samantha's MVP. So her problem is symptom B that we had just now, where teens feel isolated and unsupported. So the MVP that she brainstormed is to create a free anonymous Discord or Instagram group chat where peers can have daily check-in prompts and then with and help out each other with supportive conversations. And the proof of demand to show that this is something that is needed could be to track how many teens have joined this group chat and return within 7 days, how active they are. So the second problem is how patients often forget medications, right? So the MVP could be to build a simple WhatsApp reminder system and using manual messages or automated messages and Google Calendar notifications and see and have like the patient's response when they actually took the medication. So this in order to see the proof of demand for this is to see how many people consistently responded or reported to have improved medication adherence after 1 week. Does anyone who has shared in the group, in the chat want to share directly here on the meeting? Feel free to just unmute yourself if you'd like to share. If not, I'll continue reading out some responses we have in the group, in the chat. So a problem is that from LaShawn, which is people trust misinformation online. So an MVP could be having a post 7 short TikToks or reels to correct the common health myths with reliable sources. So citing it in the captions, providing something that's legit for the audience. So the proof of demand could be the amount of saves for that post, the shares, comments, and DMs asking for clarifications and anything. So this can help them have a better understanding and exposed to information that's actually factual. And then we have this problem where students are exhausted but think it's normal, so they're experiencing burnout. So to test out the product market fit, you can start a daily anonymous poll on Instagram stories asking students about their sleep, how many hours they got, how stressful they are feeling, the workload they have, and then following up with like sharing some coping tips or resources each day to show that they are supported, right? So in order to see whether or not this is a good product, has a good product market fit, we can measure it by their engagement, replies saying it's relatable, or students asking for more support. So we also have one more where many people lack CPR knowledge. The issue is teenagers often want to help in emergencies but don't have the skills to do so. So in order to do this, um, the $0 MVP could be using one lunch hour to host like a lunch hour CPR awareness demo at school using YouTube videos or basic explanations. Maybe if possible, getting a mannequin from different organizations to sort of let them try it out. So the success for this would look like people staying after to ask questions or signing up for the actual certification program or having teachers inviting you back to the school to do the workshop again. And then we have one from Adele. Do you want to share yours?
Yeah, I'll let Emma go first and share hers, and then I'll go after maybe.
Yeah, sure. So an idea I had was just about just increasing awareness in adolescents about global health issues across many different countries. So one of the problems I think today are that many teens are unaware of like these broken health systems across the world, and also social media tends to really focus on the bright side of things like health innovation, which isn't bad, but also it can kind of overshadow some of the negative effects that are taking place worldwide. So one of like a strategy that I kind of brainstormed was just gathering members from different countries or having like a representative from each country with a different healthcare system, having that person share about just how healthcare kind of runs in their country. And yeah, just gathering that group and creating like a social media account or a Discord server, just sharing all this information. And we can kind of measure our success by seeing just the overall engagement levels, like how many people are like replying in like comments or liking the post or viewing it, can all be factors that measure like this engagement. And also, yeah, I think that's pretty much what I have to say. Adele can share now. Thank you.
Yeah, that was amazing. And a lot of the projects that people do start like this, like as an idea. And you know what? I thought I would just do something funny and do Dr. Interested as my MVP. Um, and so basically, I picked our third pillar, which we work on, which is the lack of community space for youth online. And the idea for this is a online Discord server built around mentorship, where you can have office hours with medical students and different advisors and different people in the fields you want to go into, with events where you can see people like you doing things you want to do, and an open space where you can ask questions, find and reach out for opportunities, talk with people, and work together on projects. And success looks like people joining, getting up to 1,500 members, and more or less running out of space on Google Meet like we did today. But this was kind of just like sharing, like Dr. Interested started like this. And so it is really amazing having these ideas. And if I want to encourage people to share out loud, because then people will feel like giving out feedback. I can already see in the chat that Kathy gave some amazing, like it looks really amazing as well about the idea. And so sharing out loud will give you that chance to get that feedback. If anyone wants to raise your hand, put it in the chat.
Oh, does anyone else want to share? Okay, let's see. Priya, would you like to share yours? Okay, that's totally fine. So Priya's problem is that newcomer families don't know where to go for walk-in clinics, mental health support, and urgent care, which is a um, really great problem that local communities have. So what could be tested in 7 days? So her idea was to make a simple Canva infographic on how Canadian healthcare works in easy language and also maybe in the languages of those immigrants. And this can help them understand better on how the healthcare system works here. So, how do you know it matters or how do you know it's effective? So, community will know whether or not it's useful if community organizations repost it or families message DM them for seeing how it helped them with their journey here. So, let's move on to the last part of our presentation, which is overcoming barriers, as Lilith also introduced earlier. So, yes, we can go to the next slide. So, imagine you're running this project for 1 year now, and your project has failed. What do you think the reason would be behind this? So, you can just leave maybe point form notes briefly in the chat, sharing how you think, like why you think your idea would have failed.
And this is centered around that idea that once you understand what's preventing it from growing, you'll be able to fix that and grow it further. It's not that, like, you just failed, you learned something from it. And now what are we
Yeah.
going to do with that learning?
Okay, so now that we're waiting for the responses, some examples could be not having the funding to build the project. Well, then to overcome this problem, we can perhaps apply to different grants from programs or government grants. Okay, we have some responses here. And then another thing could be having social stigmas on people who are like using or wearing medical equipment because they don't want to be seen as incapable or have other biases against them. So maybe making the wearable more stylish or making it sort of like a fashionable item for those who in need, not making it trendy though. this could perhaps help them to feel better about their situation as well. So we can look at um Samantha's failure reason for her mental support for teens could be it isn't able to scale because it relied too heavily on peer conversations without having enough structure. Some users may be uh, dominated the discussion while others stop engaging because they don't feel emotionally safe or stable enough to return to this space. And as for the medication reminder support, it might be failing because manual reminders didn't scale and wasn't reliable long term. So once the initial novelty wore off, people probably often start muting the messages or ignoring them, and there isn't really much personalization here. So some ways to improve this could be to have a personalized reminder system that adjusts based on their routines or having it integrated with their caregivers so they can remind their family members for medications. Anyways, we got some really good responses so far. If you guys are still typing, feel free to send it into the chat and continue. But we will first move on to the raffle entries. So you guys can fill this Google form out with some feedback as well as your some personal information for us to contact you if you win the raffle. And if you're still sharing your ideas for overcoming barriers, you can also feel free to keep doing so in the group chat. The link for the raffle entry is also pinned in the chat, so you guys can access it there. LaShawn's barrier would be that it didn't scale because it turned into just another content page in a crowded feed. And even though the facts were solid and factual, people scrolls past it because unless the myth is like something trending or very interesting, they might not be interested in it. So that's one. And for Emma, let me okay, so LaShawn's idea. So maybe in order to make it not like an ordinary content page, they could start hosting events that are maybe virtual events like this one, workshops like this, or having in-person events in maybe community centers to actually expand their reach and to actually educate people on those topics. And then Emma can share hers as well.
Yeah, so I was just thinking for my idea, like I mentioned before, about just having those global representatives. I think it's also maybe a bit too ambitious, as if no one knows about the organization and then I try to suddenly get all these people to be a part of it, no one's really going to think of it as like a credible thing to be a part of. So I think maybe a solution to that would actually just be starting small or locally and then expanding it. Finding local leaders and then slowly just expanding throughout the nation and then going international.
That's great. Really like your ideas, Emma. So just a reminder for everyone. Oh, a representative from Mexico for Emma's organization. While you guys are filling out the form, if you guys are interested in joining Dr. Interested and becoming part of our community to explore more opportunities like Emma, the event that Emma did, which is Disease Discovery Day. We have events hosting every month, basically, and we have a research proposal competition coming out soon with prizes. So if you want to join our community and explore more opportunities and be part of this initiative, feel free to refer to the link tree here.
We'll give it a minute or so if anyone has any questions, but thank you all for coming today. Thank you to the Canadian Innovation Week for having us and to the Rideau Hall Foundation, along with the support we received from the Global Foundation of Canada.
So this event is going to end soon. We thank everyone who joined and participated. We loved your ideas. We hope that helped you to narrow down a project idea of yours and maybe perhaps explore it and expand it in the future. Maybe Emma could start her international organization. So just a final reminder, the attendance sheet has to be completed to be count towards the raffle entries, as well as the volunteer hours and certificates. And we hope you have a nice rest of your day.
Thank you everyone for joining, and you are free to go now.